Last month, Massachusetts became one of the first states to launch the Pandemic Electronic Benefit Transfer Program. The program provides qualifying families up to $28 per week per child for food benefits, an expansion of the existing food assistance program. In Pittsfield, every child from kindergarten to 8th grade is eligible for the benefits. And Massachusetts stay-at-home advisory and the essential business orders are set to expire on May 4th. And Politico is reporting while it's not clear if things will start to reopen next week, Governor Charlie Baker said on Saturday that face coverings will be a fact of life when non-essential employees do go back to work. These days, you're likely finding yourself scrubbing your hands with soap and water more often than you used to. Josh Schimmel, the executive director of the Springfield Water and Sewer Commission, is charged with making sure much of the region gets that water. He told us that a rate increase is coming for customers, likely in May. That's due at least in part to the impact of the new coronavirus. But I first asked Schimmel details of the state of emergency the commission entered into last month.
We were in the process of kind of putting plans together in response to the COVID-19, and really understanding our vulnerabilities in terms of staffing and the number of staff that we have and the number of specialized staff that we have to operate our facilities. We really thought we were at risk for mass absenteeism that could affect our ability to actually produce water and treat the wastewater. And so we really quickly implemented a plan and already had some plans in place for pandemics as part of our preparedness, and revised that to address specifically COVID-19. And then during the course, it was Friday the 13th, and between Friday the 13th and Monday the 16th, spent the whole weekend on the phone talking to a bunch of other utility managers and utility directors and responses and water and sewer utilities, but also electric and power utilities and gas utilities, and gathered a lot of information and kind of realized pretty quickly that we didn't want to be chasing this at all. So on Monday the 16th, we implemented a drastically reduced workforce in order for us to preserve our critical employees to be able to respond to emergencies and mass absenteeism or the potential thereof. So we really dialed back a lot of what we do, and have kind of been prepared to respond to the emergencies that come up in our business day to day in a different manner than we would typically.
When you say drastically reduced, you mean more people are working from home, fewer people in the plant, or did you have to lay people off?
No, we have not laid anybody off, and we're a pretty bare bones operation anyway to begin with. There's not a lot of fluff in anything that we do or our budgets. So we have people that were able to work from home. We were fortunate to be able to have a little foresight into what was going on with COVID-19 in other parts of the country and how it was impacting utilities. So we had put some orders in for technology a couple weeks ahead of most places. So we had about 30 laptops on order. So we were quickly able to put a lot of people working remotely. Our entire customer service staff we deployed technology and had them working from home by the 18th of March completely. So we were able to put a large portion of our workforce working from home. And then people who at the treatment plants, at the water treatment plant and the wastewater plant, we reduced that staff so we could limit exposure to those folks. We created floor plans where there was no face-to-face contact. We isolated areas at both treatment plants so that we didn't have folks coming in contact. We changed how we did shift changeovers, so there was no longer a face-to-face meeting. And then we drastically changed shifts where we were typically at the treatment plants a 3-shift, 24/7 operation. We switched to 12-hour shifts. And 4 days on, 4 days off at the water plant, and a different scenario at the wastewater plant. But really switched to 12-hour shifts and created A, B, and C teams and we had a C team sitting on the sideline that was not coming into work, and A and B teams doing the first and second shifts. And then that allows us to have a standby team in case we do have some absenteeism.
So many changes there just to be able to assure, and I don't use that word lightly, but to be able to assure that when you open up that tap, the water is still coming out, because what are we doing a million times a day now? Hand washing. My hands are beet red because of it and dry. But someone from your office told me that water consumption is down 15 to 20%. How is that possible? I would think that water consumption would be going through the roof right now.
Well, I mean, you have to think, I think for different utilities, you're affected differently by this. For Springfield, we still have a decent industrial base. We have colleges, universities, public schools, all facilities that use a lot of water. And so when all of those facilities kind of shut down, the schools, the casino, some of our largest customers on industry shut down, you end up seeing a drastic reduction for us in water production. So we don't have the financial impacts yet, because our billing for March was just sent out at the beginning of April. So we typically won't see those payments coming in for another couple weeks here. But production at the plant, or demand per se, is down about 15%. So that will have, as we project that out, catastrophic financial impacts to what we're trying to do here, which is really, and you and I have discussed this many times, investing in the water infrastructure, critically important.
And for you, the way that the bills get paid there is by people paying water and sewer fees, right? So if water consumption is down, how, if any way, can you make up that gap?
Well, I mean, our revenues are strictly based on what we bill to our customers. So, unlike many municipal operations where you get money for streets, or you get federal or state money to help with your municipal programs, the Water and Sewer Commission does not get any, or virtually none, of that federal or state support in the forms of revenue. So we're purely based on our billing. And so the only way we make that money up is to eliminate work and eliminate projects, or to raise rates. So there'll be a combination of all of that we really will be focused on. We've been focused on it for the past month, and we figured some projections out, and there's major impacts. And it's not being felt just at the Springfield Water and Sewer Commission. We have spent, as many people have, right? We're all working from home and spending a lot of time on calls like this. I mean, the first 3 weeks of this, I was on the phone 10 hours a day with other utilities, and sat in on a couple national calls, spoke directly with the EPA administrator on a small call with a couple utility leaders, to discuss what these impacts were going to be, and continuity of operations. And then, the next step is the financial impacts. And so this is impacting water sector utilities across the country drastically.
I completely appreciate that Springfield's not alone in this. But when you talk about the rate piece, do you know yet about how much of an increase you're going to see?
I mean, I think that we're probably going to see the largest rate increase that we've seen in a long time, maybe since our existence, to make up for this. And what I'd like to say is, we get the fact that it's a very difficult time for many of our customers, and the socioeconomics of Springfield aren't great to begin with. So, we're rapidly trying to develop some customer assistance programs that can help out our most challenged financially customers. We've suspended all of our shutoffs. We're developing longer term payment plans, where we typically would do try to stick to a year. So we're trying to put in place things that can help out our customers and the population that we serve that are struggling. But at the end of the day, right, we've talked about this many times over the years, is what is water worth, right? Drinking water and water disinfection was born by pandemics, cholera outbreaks, etc. So, we've always said that drinking water and wastewater treatment are really at the core of public health. You said it yourself. You're washing your hands 10 times a day right now, and that water needs to be clean, and it is. So we've always kind of we don't try to sugarcoat the fact that to produce water is a very, very challenging task and an expensive task.
You mentioned cholera. I know at the outset of this particular pandemic, there were questions and concerns from the public about, will water be safe? Is this something, can COVID-19 show up in water? Both the CDC and the World Health Organization have said that they're confident that this is something that will not transmit in water, or hasn't thus far. But have you had people calling with concerns about that? Have you heard concerns from the public?
Yeah, we have, and I think as an industry as a whole, I think the message has been pretty clear. We've done several press releases. It's up on our website. The fact that we disinfect our water with chlorine also kills off other viruses as well as COVID-19. So there are no issues. There are no issues with COVID being in the drinking water system. There are some concerns about it staying active in sewage, but there have been no reports or research that indicates that. There's some studies that can find the indicators of COVID in wastewater, but not necessarily that it's a viable virus. So obviously, the safety of our employees and our ability to continue to provide these services is critically important to us. So we follow those guidelines from the CDC and from the water sector leaders and organizations from a national perspective. That really, we have daily briefings, daily calls from a national standpoint that are updating information as it becomes available from CDC and other sources.
And just briefly in the time we have left, do you have what you need in terms of protective equipment for your staff?
Yeah, we're one, because, I would say close to 80% of our workforce is on standby right now. So we, you listen to the stories that are out there. Getting PPE is extremely difficult, and everybody's procurement person and stockroom person are like superheroes right now, and we're no different. Trying to procure safety equipment any way we can. We have a limited supply. We're on a call with the state earlier today and have a call this afternoon about some FEMA cloth masks that are going to be made available potentially to the water sector. So we're going to take the lead in trying to help distribute that to the smaller utilities, water departments and wastewater departments. So, safety equipment is we're not, if it's unsafe, we're not doing the work at the end of the day right now. If we can't keep our people safe, we're not going to put them in harm's way.